Hello, everybody.
Hello,
Hello, everyone. Thank you so much for joining us here today. Today is another very, very informative session and very most required, of course. So let us start. We have quite a few people in, so let us start with the session for today. Tina, can you share the slide, please? Okay. The first slide. Okay, so today the session is about strengthening your heart and immune system post 50. Yeah, next slide. And a little bit about our mission here, get set up. We are on a mission to help those over 55 learn new skills, connect with others, and unlock new life experiences, which I'm sure most of you who have been with us for some time would know that we are totally focused on this. Our goal is to reduce isolation, loneliness, and equip the community with the tools and knowledge to age independently. Our community engages in classes online as well as through offline activities like traveling over long trips as well as short trips. Yeah, the next slide. And today's speaker is Dr. Sunil Kumar Wadhwa. He's an experienced cardiologist. He brings over 18 years of experience as a principal consultant in cardiology at Max Hospital, Gurgaon. He has an extensive experience in interventional cardiology across renowned hospitals like Batra, Medanta, Rockland, and Primus. He's specializing in acute heart attack management and heart failure therapy, including CRT. His work experience expands over a decade in interventional cardiology across Delhi NCR. His education and training, he's done his MBBS from PT and the BDS, PG, IMS, Rohtak, and DNB certifications from Medwin Hospital, Hyderabad, and Batra Hospital, New Delhi. His specialized procedures, he's proficient in radial root angiography, angioplasty, peripheral interventions, pacemakers, AICDs, combo devices, and structural heart disease interventions. So he is a super qualified doctor who's going to be addressing some heart issues for us today. So relax and you can put your questions on the chat as he's talking. We will definitely try to take all the questions. Or during or definitely after he finishes speaking. Doctor, if possible, let's keep it a little interactive. So you can probably stop in between so that we can take a few questions on and off.
Thank you, Anita. And it's a great pleasure to be on this platform. And Ms. Sunita has been after me for doing one or the other sessions for at this platform. And I've done one session earlier also, I believe that was on blood thinners. And then she asked me, can you do it one more? I said, with the topic, I said, I don't understand what should be the topic. And then she only suggested that since we all are post 50, so why not talk something which benefits all of us from the heart perspective. So today I'll be just talking in general about what all we should be careful about and what all we can do to safeguard ourselves in post 50. That's once we have crossed our, you can say, middle path wherever we are supposed to go ahead. A few facts about the human heart. As you all know, heart is a simple muscle, and just like the any other muscle in the human body, it keeps on working always. But the best part is it does not get fatigued. It keeps on working every day, and all the 24 into 7 it is pumping the blood into your body, and you can just see around 2000 gallons of blood each day is something it pumps. 1 gallon is somewhere around 3.7 liters. So if you see, that means approximately 10,000 liters of blood is pumped every day by the human heart. The heart continues to beat at a rate of around 60 to 100 per minute. Next, please. Next slide, please.
Next slide, Tina.
So how does the blood travel from the heart? The arteries are the ones which carry the blood from the heart over to the different parts of the body. The veins are the vessels which bring the blood back to the heart. And capillaries are very, very minute vessels where the exchange of the nutrients, oxygen, carbon dioxide, everything takes place. And so from the heart, blood goes in the arteries, reaches the capillaries, exchange happens, the blood comes back to the veins, and then back to the heart. This is what this, in a very simple manner, what happens. Next, please. So why are we talking about today about post 50? From this slide, if you can make out, the blue ones are the men more than 65 years. Purple are women more than 65 years. The yellow are men and women more than 80 years of age. So if you see, as we grow older, each and every disease becomes more common as you grow older. CVD, cardiovascular disease, high blood pressure, coronary artery disease, atrial fibrillation, strokes, heart failure, peripheral arterial disease, arthritis, that is your joint problems, diabetes, osteoporosis, Alzheimer's, everything worsens with age. And by the time we reach the age of 85, almost every disease is present in the human body. Next, please. Next slide, please. Only 5%. So why do we talk about, I'm getting confused because the control is not in my hands. 50% of elderly women and 75% of elderly men, they have got an obstructive coronary. That means there is a blockage in the heart arteries. Men tend to have more of the problem as compared to women. Women have been, by nature, they have been given the protective mechanisms. But after a certain age, when you grow older, then these protective mechanisms, they just disappear. Say after the age of 60, men and women both are at the same risk of developing a heart problem. Octogenarians, that is people who are more than 80 years of age, they are just 5% of the total population. India is a young country, we all say, and the people are younger. Only 5% of the population is more than 80 years. But if you see the hospitals, 20% of the hospitalizations for heart attacks and all, 20% of the beds in the cardiac ICUs, they are occupied by the people who are more than 80 years of age. The moment we do an angiography in these older individuals, we always get worse disease. If we do an angiography in a younger individual, it will be maximum one or two arteries which are diseased. But in an older individual, if you do an angiography, we will find multiple arteries which are getting the blockages, and not only multiple arteries, but at multiple sites also. In a single artery, we can find blockages in 2 to 3 places. Next, please. So why are we talking about problems in elderly? Okay, one is that the disease is more severe. What next? The second is erratic drug taking as well. As you grow older, we have seen that people who are elderly, they don't miss out their drugs. They forget to take the drugs. Half the drugs they keep at home, half the drugs they are keeping somewhere else, and they may forget to take those. If there is an attendant to give them the drugs, or there are children at home to give them the medicines, fine. Otherwise, they can miss. So for them, yes, there are specific medicine boxes available where they keep the drugs as per the hours, morning, afternoon, night, and as per the days of the week, but still they can forget. Multiple pathologies. At a given time, you will see that people who are having multiple diseases, like a person may be having diabetes also, a hypertension also, heart disease also. There can be a prostate problem also as you grow older. And then if there is a smoker, The person can be having a lung disease as well. There may be COPD. So at a given time, there, as you grow older, there are multiple diseases which are present in a given individual. So multiple diseases, multiple drugs, and then so many drugs. There are so many patients who come to us, डॉक्टर साहब दवाइयां कम कर दो किसी तरह से, मेरे इतनी सारी दवाइयां हैं, कुछ कम कर दो. So that is what happens. Then there are altered pharmacokinetics, low GFR. That means the body's mechanisms to handle various medicines and to handle various chemicals that keeps on altering, that keeps on decreasing with age. The ability keeps on decreasing with age. The kidneys, whether there is a disease of the kidneys or not, with age, they keep on decreasing in their ability to function. There's an increased sensitivity of the brain and the heart to the drugs. The moment you give a sedative drug to an elderly, there is a chance that the person can have an extreme sedation as well. So with age, there's an increased sensitivity as well over the various organs of the body. Next, please. One person dies every 33 seconds due to heart attacks in India. Why do the heart attacks happen? They happen because of the blockages. Here, if you can see over here in this slide, this is a normal heart, this is a normal blood vessel. Over here, it is normal. But here, the yellow thing, this is a plaque. The plaque, that means the cholesterol deposition. These cholesterol depositions, they cause a narrowing of the passages. And that is something which causes us the problems. Next, please. So if you are living in towns or cities, then you have a risk of 3 times more of having a heart problem as compared to the people who are living in the villages. People who are in rural backgrounds, they tend to have lesser heart problems. We Indians tend to have a heart disease 10 years earlier than people who are living in Europe or in USA or in Europe, other European countries, or say Japan or otherwise, because of our we being an underdeveloped, or you can say slowly we are now moving into developing country. And yes, one day we will be a developed country, but as of now we are an developing country. And in our country, we do not have that much resources. We do not have that much awareness among the people that we can prevent diseases. So in our country, we tend to have heart disease 10 years earlier than other people who are in the West. Most of the heart attacks which happen, they happen in the morning hours when we are yet sleeping, say 4 to 8 o'clock. People are half asleep at that time, or many of us are still sleeping. 25% of these attacks are silent, and most of these attacks happen in diabetics. Every day we get patients who come to us with one or the other problem, and we do their ECG or we do their echoes, and then we tell them that you have already suffered a heart attack. And they say, no, I have never had a heart attack in my life. We tell them there are certain silent attacks as well, where you will never come to know that you are having a heart attack. And most of these people are diabetics. Next, please. So what are the symptoms of a heart attack? How do you come to know whether you are having a heart attack or not? One, you can have chest pain, which is a short duration chest pain. We do not consider it as a heart attack. It has to be a longer duration, especially at rest. And if it increases on walking or on any activity, that is a typical sign of a heart disease. There can be an anxiety feeling, there can be severe sweating, breathlessness, or in some severe cases, the patients can collapse, they can become unconscious. There can be vomitings or there can be nausea associated along with the chest pain. The chest pain which happens cannot be simply from, it's not only in the chest area. A chest pain which happens because of the heart can range from the level of your jaw, say here, it starts from here, and you keep your arms extended. It can happen in your arms like this, the right arm, left arm, and also it can be in your upper abdomen up to the level of your umbilicus. Any pain which is happening in this region can be because of your heart. It's not that only the heart area, in the chest area, it will be there. It can happen anywhere in your right arm, left arm, front of chest, back of chest, anywhere. But the catch point is, if it is severe pain, crushing kind of pain, and if it is lasting longer than say a minute or two, please do consider it to be a heart pain. Next, please. So this was a heart attack, something called a stable angina. Heart attacks happen when there is a 100% cutoff in the artery. If there's a blockage in the artery and there's a 100% cutoff there, zero blood supply further down the lane, that causes the heart attack. But supposingly it is an 80% blockage or a 90% blockage, that usually causes a stable angina. So what is a stable angina? In stable angina, the patient will feel the same kind of pain anywhere in your body, upper body, but that will come on exertion. The chest pain or heaviness which comes on exertion, say on walking or on climbing stairs or on any physical activity. And the moment I take rest, it subsides. And it again reappears when I'm doing the activity. So that is a typical thing of an angina pain. The in-between episodes are usually stable and there are no symptoms at all. So but on echo or on treadmill test, we can find that this patient is having a stable angina, and then we can discuss the patients. These patients of stable angina, they usually benefit with nitrates. Nitrate is a typical sorbitrate tablet, which we advise to people to keep under the tongue whenever they are having a pain on walking. Sorbitrate, please keep in mind, sorbitrate was earlier recommended for heart attacks, but it is no longer recommended for heart attacks. These days, we recommend it only for stable angina, not for heart attack. Next, please. So what is the treatment of heart attack? The first line treatment for everybody has to be aspirin. Aspirin is the most common and the most effective medicine which is available for a heart attack. You will ask me, in what form shall we take it? Aspirin is available as Disprin. One tablet of Disprin, you have to just keep in your mouth and chew it. Nothing has to be done. Chew the tablet. That's it. And then statin. Any statin, if it is available at your home, take that. And then sorbitrate, as I said, has no role in heart attack. Sorbitrate has got the role only in angina patients, not in heart attack. Take the patient to the hospital as soon as possible after giving aspirin and statin. Get an urgent ECG done and rest, leave it for the doctor to decide. Please do not be your own doctor over there any moment. Next, please. So whenever there is an heart attack, you take the patient to the hospitals. But what we see, and as you can also see from this slide, thrombolysis is a medicine which is given to dissolve the clot. So if you see in more, as you grow older, the treatment modalities which are opted by the patients and by the physicians, they keep on decreasing. Why? Because there are more complications because of that. The more complications, that's why we just restrict ourselves to the treatments. Blood thinner medicines, that is thrombolysis, is given in only 5% of patients more than 75 years of age. Whereas in less than 75 years, we use it 39% of the times. Angioplasty is an option. More than 75 years, only in 7%. Less than 75 years, we do it more commonly. Bypass, again, in less than 75 years, it is 11%. More than 75 years, only in 5%. Aspirin. Aspirin is usually given in people who are less than 75 years of age. The moment more than 75 years of age, aspirin usage comes less. Why? Because the chances of complications, the chances of bleeding are more because of aspirin as you grow older. There can be gastric ulcers, there can be bleed, there can be piles, there can be bleeding from those piles or hemorrhoids, and then we land up in soup. As the patient grows older, the treatment modality is being opted by physicians as well as by the family members also sometimes. There are so many patients, elderly, who come to the hospital and we tell them that this is the treatment which is required. Half of the times the family members refuse. They say, no, we do not want the patient to undergo any extensive treatment. Just go a little conservative. The more conservative, the better. This is what they feel. Next, please. Next slide, please. Next slide, please. Another thing which we see in elderly, as you grow older, we have the heart blocks. We have talked about angina, we have talked about heart attacks, we have the heart blocks. Here, the patients can have a slow heart rate, that is a bradycardia, or there can be missing beats. These patients who have got a slow heart rate, extremely slow heart rate, say the rate can be around 30 or 35, sometimes 20, 25. As we said, the normal heart rate is around 60 to 80 or 90 per minute. Here, the heart rate comes as low as 25 or 30 sometimes. These patients can experience recurrent falls. They can have recurrent giddiness episodes. So we usually advise them a pacemaker therapy. A pacemaker is a small device which you can see here. See, it's less than 1/10 of the size of the palm even. And this is a pacemaker, and these are the wires which are attached to the pacemakers. We place the pacemakers in the patient's body. And if you see this X-ray, this is such a small device over here, if you can see. And these are the wires which are going into the patient's heart. And these pacemakers, we usually set them at a rate of around 50 to 60. A patient comes to us with a heart rate of 25, 30, and then we send the patient back with a fixed heart rate of minimum 60 or 50. That's what the pacemaker does. Next, please. Something else which can happen as you grow older is atrial fibrillation. Here, what happens? There are four chambers of the heart. If you can see in this slide, these are the four chambers. This is the right atrium. This is the left atrium. Over here, the left ventricle and the right ventricle. These have to work in cohesion. One chamber contracts followed by the other chamber. These all of them, they contract at a rate of around 60 to 80. But what happens in atrial fibrillation, the upper and then the heartbeat becomes irregular. And this irregularity of the upper chambers, this is transmitted down to the lower chambers, that is the ventricles. And then these patients can have palpitation, breathing difficulty, or they can develop stroke. Why the stroke? Because there can be, because of this much high heart rate, that is around 400 to 500 in the upper chambers, the blood just cannot move properly and it just comes to a standstill. So whenever there is a standstill of the blood, there can be a clot formation. And this clot, whenever it moves out of the heart, can cause a stroke. So these atrial fibrillation patients, the best medicine is anticoagulants, what we call. Anticoagulants are the blood thinner medicines, the same ones which we had talked in the last session. Anticoagulants or the blood thinners, they are especially given in atrial fibrillation to prevent stroke. That is the major benefit of the anticoagulants. And yes, now the next step comes, once we have given the anticoagulants to prevent stroke, the next step comes the rate control. We have to control the rate. This 400 to 500 per minute rate has to be controlled. These are with the various medicines which are being given. Next slide, please. So a stroke which can happen because of the clot in the heart, that can cause because of the brain infarction, because the clot has traveled from the heart over to the brain and has caused the clot formation. But yes, sometimes there can be a bleeding in the brain that can also cause the stroke. So whenever we give the medicines to the patients, those are the blood thinner medicines, one has to keep a balance also. The blood thinner medicine should prevent the clot formation in the heart, should prevent a stroke happening in the patient, and also should not cause a bleeding in the brain or anywhere else. Next, please. The next thing, which is very, very common in elderly, as you grow older, we tend to move less. We tend to confine ourselves to the beds. We tend to confine ourselves to the indoors. The more we are confined in, we are going to have a chance that we can have a deep vein thrombosis, that is a venous thromboembolism. This is most common cause. The legs can become swollen like this and red. This is a normal one. This is the leg with the deep vein thrombosis. We call it a DVT. Why can what this happen? It can happen usually in bedridden patients, say after any major surgery, when the patient is not able to move around, say hip surgery, knee surgery, because the patients cannot move much. Then any sort of injury, if that happens, because of injury, the patient is not able to move, that can cause the deep thrombosis. In long flights, because we tend to sit in one place as well. Say in the current generation or in the elderly also who are frequently traveling from say India over to USA or to other countries, whether to meet their children, whether to meet their grandchildren, or whether for recreational activities. A long flight tends to pose a danger for us because we tend to sit for long hours. So the best way to prevent a clot formation in the legs during a long flight is keep moving. Every hour, keep moving in the flight. Do not restrict yourselves to that small chair and don't be cramped up in that single chair all along the flight. Whenever there is a deep vein thrombosis, this clot from the legs can move. And if it moves, it goes to the lungs. And if it goes to the lungs, it can cause breathing difficulty, chest pain, and all those things. So we are the most dreaded thing in case of a DVT, that is the clot formation in the legs, is if the clot moves from the lung to the lungs from the legs. This can be fatal as well sometimes. The disease can be terminal in these patients. So how can we prevent a clot formation in the legs? As I said, the first thing is keep moving, keep moving. Don't be sitting for long hours. Do not be lying for long hours. The next is stockings. You can wear the stockings. These are the stockings which you should be wearing. We recommend these stockings to people who are in the elderly age group, post-surgical groups, that they should wear tight stockings so that there can be less of clot formations. Next slide, please. Here you can see people are so cramped up in their flights. If you see, these are the most common risk factors for the clot formation. Next slide, please. So what's wrong? How can we improve things? We have talked about heart attack. We have talked about clot formation. We have talked about stroke. We have talked about atrial fibrillation. We have talked about everything. So what is wrong? How are we going to improve things? The first and most common thing is the lifestyle. Almost everything in our lifestyle is wrong these days. Next, please. This is all what we do in our life, day in and day out. People are having diabetes, they have hypertension, they are obese, keep on sitting, eating junk food, and smoke, and just keep sitting. As you grow older, you don't tend to walk around, keep sitting. So that's what the problem is. Everything is, whichever we consider over here, that is bad for our health. So these have to be taken care of. Next, please. So whenever we say that there are the risk factors, there can be modifiable risk factors which can be changed by an individual, and there are non-modifiable risk factors. Modifiable risk factors are like obesity or high cholesterol, smoking, hypertension, diabetes, sedentary lifestyle, stress in our bodies, obesity, waist circumference more than 40 inches in men and more than 35 inches in women is considered as the biggest risk factor. So all these are the modifiable risk factors where we can intervene and we can change. If we act well in time, we can change these factors. Next, please. What about cholesterol? Cholesterol can be bad or good. There is a big argument these days whether the cholesterol is good or bad. Poor cholesterol, he has been shown to be bad. This is what I'll say. Cholesterol is not that bad. Our body is made up of cholesterol. The basic thing which makes up our cells is cholesterol. Without cholesterol, we cannot live even a single day. Cholesterol is a building block. But yes, the problem is when there is too much of fat because high calorie fat. Cholesterol is high calorie, fat is high calorie. And whenever there is a too much of fat, that can create a problem. Or problems occur when the fat is saturated. Saturated fat causes the problems. MUFA and PUFA, that is unsaturated fats, they do not cause that much of a problem. Trans fats or the saturated fats, they are the culprit. So one should avoid trans fat. So you'll ask me what all contains trans fats. Trans fats are present in our fried items which we are buying from the market, like samosas, kachoris. So that is what it is. You eat your burgers, pizzas, whatever is made in the market. So my recommendation always to my patients is please avoid anything which is being prepared outside your home. If you are preparing your food at home, that usually is having more of mufa and pufa, but the moment you are buying it something from the market, you do not know what it contains. What are the contents in that, which usually are trans fats. There was a time once when people used to buy Rath Vanaspati or Dalda Vanaspati, and it was considered as an alternative to ghee. That was the worst thing to happen on this earth. Rath Vanaspati and Dalda Vanaspati, they were totally trans fats. And our governments, they themselves provided us with all that. That was a sad part. Anyways, it's over now. Next slide, please. Smoking, another factor which causes all the problems. Smoking can increase the blood pressure, it increases the heart rate, increases the peripheral vascular resistance, can cause the clot formations or stenosis in your legs or arms. It increases the clot formation in the body, decreases the HDL level, that is the good cholesterol levels. Next slide, please. The smoking sessions, they can reduce mortality by 25 to 50% post heart attacks. A normal heart lung, this looks like this, and whereas a tobacco smoker's lung is like this. So if we can suggest stopping, that is cessation of the smoking, that can reduce the heart attacks by 25 to 50%. That is what I mean. We can do the interventions in the form of physician advice. There can be support groups, nicotine replacement in the form of chewing gums or some other tablets like that, cardiac rehab programs, and counseling sessions for the smokers. Next slide, please. Hypertension is another factor which causes the problems. As I said, people who are above the age of 60% of those people will have hypertension if we consider any community. Blood pressure causes a 3 times higher risk of a heart attack, of a kidney problem, of a stroke, or any sort of peripheral vascular disease, or a bleeding in the brain. Any cardiovascular mortality increases to the extent of more than 3 times in hypertensive patients. So the target is to reduce your blood pressure levels The next slide, please. The most common measure which we tell patients to reduce blood pressure is by restricting the salt. Our normal Indian diet, it contains usually more than 6 grams of salt. That's what it is. Whereas the recommended is only 2 grams. We Indians tend to eat 6 to 8 grams of salt per day, whereas we should be restricting ourselves to only 2 grams of salt per day. And each spoon of salt is 2 grams. So 1 spoon is what is recommended per day for one adult, not more than that. But yes, as you grow older, the chances of having a low sodium are also very high. So for elderly people, we usually tell them to restrict salt, but not too much. So what we tell them that please add a normal salt as other members are adding to your diet. Keep having the same diet as the other members of the household, but please do not add any extra salt if there is less salt in the diet. Please do not add any extra salt in the curd, no extra salt in your salads, no extra salt in or any say chatpata masalas and all that. Please avoid those. And if your diet someday the dal or sabzi contains less salt, please do not add extra salt over to it. And please mind that senda namak, kala namak, rock salt, red salt, all are salts. There is no difference. At the end of the day, they all are salts. There is not much difference between white salt and rock salt when it comes to controlling your blood pressure. Rock salt will also increase the blood pressure. White salt will also increase blood pressure. The best method is to restrict salt intake. Any salt, restrict that. That is the best. Next, please. So, whenever we are treating the patients for a high blood pressure, and first thing for elderly, for younger individuals, we can give a higher dose as well. But for older individuals, we should start slow, go slow. That is the fact. Because the elderly people, they all tend to become orthostatic. Orthostatic means that the blood pressure while sitting will be slightly higher, but when I'm standing up, the blood pressure is lower. All medicines, they do cause this. They will decrease the blood pressure on standing. And especially elderly people. All elderly tend to have this problem. So 1 plus 1 will become 11. It will not become 2. And one more thing, most of the elderly, they will require combination therapies. One drug will not work for them. 2 to 3 drugs usually work for them. Elderly, they do not want diuretics, do not want to go to the washroom again and again. So one has to be cautious. Yes, cost also has to be taken into consideration because people are retired at some age, say after 60, people are retired, and then the cost comes into the picture. You cannot give them too much of costly medicines. Not all of them have got money in hand to buy all the medicines. Next, please. Aspirin, as I said, it is the best medicine for a heart attack treatment as well as prevention. Greater benefit has been seen in the elderly with heart diseases with aspirin as compared to youngers. Men are benefited more as compared to women with aspirin. Next, please. If you do not want to end up paying so much as I've shown in this slide, then one should be cautious. Please take care of yourselves. Otherwise, you might have to end up paying for all this for your heart. And admission in the hospital can cost you somewhere around 20,000 to 25,000 rupees. Angiography, angioplasty, then bypass. They all are costly affairs. Everybody cannot afford. Next, please. Next slide, please. But nobody will listen to me. That's what we have seen. This is what we all do for my treatment of falling hair and for my facials and all that. I will go to everybody, get all needle pricks and all electric hair brushes and everything. Go to any Tom, Dick, and Harry, but I will not go to the doctor. That's what most people do. Please avoid this. If you have a problem, go to a doctor, not to a quack. And please, if avoid going to any RMPs and all that. And yes, we have got these days Baba Ramdev and so many other Babas also who are giving the treatment for everything. But please be cautious and please just see in your surroundings what is happening. That's what I will recommend. Next slide, please. So prevention is always better than cure. And as I said, the cost of treatment in the hospital is way too much these days. All the hospitals are way too costly. Prevention is much, much cheaper. Prevention will not cost you anything. It might just be, in fact, if you do not eat too much, if you avoid too much of fat, if you avoid too much of sugars, if you avoid too much of sweets, you might even save on that money, in fact, rather than, again, I'll say spending on that. Next slide, please. So please go a little slow. Enjoy the journey of the life. Enjoy it. And next slide, please. Next slide, please.
Tina, next slide.
So the best way to reduce your heart disease is you can take a simple message from this slide itself. Reduce your stress levels. Do not set unrealistic targets. Take your leave. Never take your work home and do not encash your leaves. If you have the leave available, take it and do not go for an earned leave that I have an earned leave available. I'll encash it later on. If you get the money instead of your leave, then that money will be used for your treatment itself and on nothing else. Please do keep it in mind. Next slide, please. A 30 minutes of brisk walk 5 days a week is what is minimum required. That improvement leads to improvement of exercise tolerance, reduction of the cholesterol levels. Improve exercise does help in the psychosocial well-being as well, and it lowers your blood pressure, lowers your sugar levels. That's what is required. So an exercise is a must to prevent your heart problems. Next, please. Sleep, an important aspect. Sleep is a state of rest over sustained periods. Sleep provides us with the time for repair, recovery of the mind and body, restores the energy levels, and gives us a feeling of well-being. 6 to 7 hours of uninterrupted sleep is what is required. Less sleep is also bad, and oversleeping is also bad. These are 6 to 7 hours of uninterrupted sleep is what is required, and one should always aspire for that. Next, please.
Doctor, can we take some questions now?
I'm just having 2 slides more,
Okay.
and after that, can.
Okay.
Next slide, please. Yoga and meditation, they do help. Next slide, please. They help in coping with the stress. They help to avoid smoking. They help find contentment from within. That's what we have been always learning from our seniors as well, that yoga and meditation are what are required. Meditation just keeps you calm and it helps you to find contentment from within. That's what is required. So next slide, please. Next slide, please. So these are various asanas which have been recommended from the heart point of view. Surya Namaskar, Pavan Muktasan, Uttan Padasan, and Santulasan and Shavasana. These are the ones which are recommended from the heart point of view. You can do it. Yes, there are many more as well, but these are from a basic point of view. That's it. Next slide, please. Cardiac rehabilitation is required for people who have had the disease already. Supposingly, I am admitted in a hospital for a particular problem, say bypass or a valve replacement or heart attack or whatever. The cardiac rehabilitation should start ideally in the hospital itself from the day one. You give the patients the training, how they are supposed to walk, how they are supposed to exert, what level of exertion they can do, how they should do, whether they should start an exercise or not, and what kind of exercises, aerobic exercises versus anaerobic exercises. Everything is taught in the cardiac rehabilitation programs which are being conducted in the hospitals as well as out of hospitals. Various physiotherapy centers, they do provide with the cardiac rehabilitation. Yes, one should learn from them, and then one can come home and then do at their own pace as well. There is a certain pace at which each and every individual can do it for themselves. Not everybody can progress at the same pace, so a different pace for every individual. Next please. Next please. Sexual activity is an important aspect. Sex is an important part of living together, adds to your harmonious life, the feeling of belongingness. But because of the various drugs, which and because of various diseases, there can be a difference in the libido. There can be hormonal imbalances which can happen. There can be an erectile dysfunction which can happen because of the drugs also, which are being given to the patients. And as the patients grow older, sometimes they feel that there is no longer a need, but it's not so. One has to consider that sexual activity is an important aspect of being harmonious and being active in the life. Next slide, please. Next slide, please. So if one lives long enough, one has to die one day or the other. But you have to see how you are going to live your life. That's what is more important. Thank you, please.
Thank you, doctor. Now, let me take some questions. The first one
The
is,
first one is why attacks
why do attacks occur
attacks occur
early
all
morning?
morning.
That's because of the hormonal imbalances which happen in the body, adrenaline levels and noradrenaline levels, which are secreted by the adrenal glands in the human body. They are higher at that time. And because they are higher in the body between, say, early morning hours, say around 4 to 7 o'clock, so they cause more of, say, the blood vessels to clot together and to constrict together. That causes the heart attacks in the morning hours.
Okay, the other question is, women's symptoms of heart attack can be different. Can you explain the symptoms to us?
Yeah, see, because women tend to behave in a very different manner. Men behave in a different manner. Men are more outgoing, whereas women are not that outgoing. So for men, it will usually be like early onset of symptoms. If they have a blockage, they can experience it more frequently, more earlier. And women, since they tend to be less active, when many a times they feel it less common. And yes, women, they tend to hide the diseases as well sometimes. That's what is common in most of the households. Women tend to hide the diseases, and that's why we say that the symptoms can be different, because women can attribute it to different reasons. And yes, because of their hormonal changes at this age, they attribute it to, say, their uh, breast changes or to the breast pain or something else, rather than to the heart itself.
Okay, the next question is, are there symptoms of blood clot? I think what she means is, if there's a blood clot, will there be any symptoms?
See, as I said, if there is a blood clot in any clot anywhere will cause a stoppage of the flow in that area. So if there is a stoppage of blood in a particular area, that will affect that. Supposingly, the clot formation happens in the arm. So the arm will become blue or it can become white depending upon the severity of the clot formation. And there can be pain in that area. Similarly, in the heart, why does the heart cause the pain? It is because of the blockage. Whenever there's a clot formation, there is lack of blood supply to the particular area in the heart, and that will cause the pain. In the leg also, if there's a clot formation in the leg, that will cause the pain in the leg. Anywhere there is a clot formation, the first thing is pain. Second thing is color change. It can either become red or it can become blue or it can become pale. Pale is when there is a clot in the arterial supply because there is a lack of the blood in the supply itself. Blue is when there is a clot in the veins which are bringing the blood back from the different organs. Why? Because there is a congestion, that is a back pressure. So back pressure will cause blue and a forward flow blockage will cause a paleness. That's what the symptoms can have.
Deepika, I think that should answer your question as well. And then similar questions. Okay, compression stockings, do they help?
Compression stockings, as I already showed in my slide as well, that the compression stockings are a must in patients who are prone for DVT or patients who have got a varicose veins. Varicose veins, compression stockings are a must to be worn whenever you are in the standing position. Lying down position, whenever you are in the sleeping stage, whenever you are on the bed, you can remove the stockings. But whenever you are out of bed, you are going out for traveling or whatever, then compression stockings should be worn, right? Always.
Okay, Radha, I'll take your question later because that's a personal one. If there is time, we'll take that. My electrolyte, okay, this is also a personal question. What is lipoprotein A?
Lipoprotein small a is a kind of a bad cholesterol, which usually we do not measure in the lipid profiles. Whenever we check the lipid profile, they will check your total cholesterol, triglyceride, LDL or HDL levels and all that. Lipoprotein small a is checked separately. And it is a kind of a bad cholesterol, which has been recently found to be even more effective in telling us whether the person is having a higher propensity for bad cholesterol or not.
Okay. A first aid in case of suspected heart attack, what is the quantity of each of the disprin, statin, any tablet to be
Yeah,
given to
that
the patient?
Disprin is available in the market as a standard tablet, 325 milligrams.
Okay, and
And the statin you can give depends upon which statin. We usually recommend a statin 80 milligrams tablet. In the market, you will find 10 or 20 or 40 milligram tablets. 80 milligram tablet is usually rare to find, but we recommend the initial dose to be given as 80 milligrams of atorvastatin. So you can give 8 tablets of 10 milligram, or you can give 4 tablets of 20 milligrams, or if you get the 80 milligram tablet, 1 tablet itself.
so can we use this for a long duration?
80 milligrams, yes, can be used. We usually recommend 80 milligrams to patients who already have had a heart attack. Post heart attack, we do give them 80 milligrams if we place a stent or something. And after a certain period, we just decrease the dose. From 80, we come down to 40, 20, 10, depending upon the patient's condition.
Are blood thinners and statins the same?
No, blood thinner is statin is the cholesterol medicine. Statin is a medicine to control the cholesterol levels, LDL levels, or triglyceride levels. Blood thinners are the medicines like aspirin, clopidogrel, Brilinta. These are the blood thinner medicines.
How to differentiate chest pain and gastric pain?
Very tricky question. Nobody can do that. Even doctors cannot.
Okay. If ASPR Athorva 150 is given,
Yeah.
why is it given? I think that's what the...
It's a blood thinner medicine which is being given to the patients to prevent a further clot formation in the arteries.
Okay, and let me take one first aid in case of yeah, this we've taken. My electrolytes are low and I'm on 3 salt pills a day. My BP is usually very high. It's a vicious circle. What do you suggest?
I believe you need the person who has put up a question, they need to get themselves further evaluated for that because the sodium levels or the electrolyte levels can be abnormal because of various hormonal imbalances also in the body because of the adrenal glands. Yes, they can be abnormal if a person is on steroids as well. Steroids tend to cause abnormal electrolyte levels. And then, yes, if you are on diuretics like Lasix or Ditor or certain medicines like this, they can also cause the electrolyte imbalances. So one has to go into the detail before we discuss all that.
Okay, last question. My angioplasty was done 5 years back, was calcification, not cholesterol plaques. Why calcification? How can I prevent forming calcification?
You cannot prevent calcification formation. Calcification is a protective mechanism which has been given by God to us. And I'm thankful that God has given us calcification, and because that calcification prevents heart attack formation. For that, I think we will have a separate session someday, or you can come to me personally and I can explain to you why calcium is good for an individual. Why is the calcification in an artery good for an individual? A cholesterol deposition can cause heart attack, but if there is a calcium deposition prevents heart attacks. One thing.
L-
So, but yes, heart attacks can happen in, say, calcified arteries as well. But if there is a calcium deposition in the arteries, it becomes difficult to treat also. So it's for the doctors to see what to do and what not to do. But God has given us calcium as a very good thing and a preventive mechanism against heart attacks. And I will pray to God that I should have calcified arteries.
Yeah, we are almost past time, but let me just take Mr. Mukesh's question. Mr. Mukesh, can you please ask your question? Yeah.
Yeah, sir, I want to inquire about various diabetic reversal programs being publicized. Are they any effective, or one should go for it or not? Because diabetes and heart, they both are very correlated
The
things.
diabetes reversal program, I don't know who is recommending that. Can you please let me know who is recommending it?
No, it is on Facebook that if some people have taken it and diabetes sugar levels have come
That's what
down,
I'm asking you, sir. They have taken it, but from whom?
they are some companies they which are publicized.
That's what none of the doctors are doing it.
Yeah. They
So
are
I'm,
attached with some
but
doctors. They
so
are attached with some endocrinologists.
so there's nothing called a diabetes reversal program. Yes, we can control diabetes. We can give you the medicines which can
Yeah, yeah.
control diabetes. And yes, we can give you certain instructions. We can let you know the lifestyle changes which will help you to control your diabetes. But once diabetes, the reversal is very, very difficult. How can I reverse from a diabetic to a non-diabetic? That is only possible if I am obese. I should cut down on my body weight. If I am in the habit of eating too much of sugars, I should avoid that. If I am in the habit of eating too much of packed food like biscuit, rusk, burgers, pizzas, I should avoid that. And then only we can talk further. But diabetes reversal is a very, very rare thing which can happen.
Thank you, sir.
Thank you. Thank you very much, doctor. I'm sorry, won't be taking any more questions because we're way past time. Thank you very much for this lovely, informative session, doctor. We hope to have you once more on the platform soon. Thank you very
Thank you.
much.
Thank you. But ma'am, next time I will prefer to keep the slide control with me.
Sure, sure,
That's
sure.
what I would like.
Sure, doctor. Will do so. Thank you.
Thank you, please. Thank you.
Thank you.